Brain death. So firstly, looking at what is brain death. Brain death is defined as a irreversible. It is irreversible. Irreversible what? Irreversible cessation. Irreversible cessation of the brain function. And what it does is the spinal cord function below the C1. The spinal cord function below C1 is it may be present. It may be present. Now, before applying the brain death criteria, these conditions must be absent. So, absence of hypothermia, absence of hypotension, also the uncorrected metabolic as well as the endocrine abnormalities. Then there is also the neuromuscular blockers. Next, there is also the drugs. The drugs are known to depress the brain function. Now, looking at what is the clinical criteria telling us. So, the clinical criteria, this includes the coma. Next, there is also the absence of the motor activity, and this includes the no decerebrate or the decorticate posturing. Next, what we see is the spinal cord reflex. It may be preserved. Now, moving ahead, there is the absent brainstem reflex. This includes the no pupillary as well as the corneal, vestibulocochlear or the gag reflex. There is also the absence, this is of the ventilatory effort, and this is with the arterial carbon dioxide tension. This is greater than 60 mm Hg or 20 mm Hg, and what is to be seen is it is above the pretest level, and this is the positive apnea test. Now, how do we confirm if it is a brain death? So, the confirmation, it includes isoelectric electroencephalogram. Next, what is seen is the absence of the brainstem auditory evoked potential. Next, there is the absence of the cerebral perfusion, and this is documented as the angiographic as well as the transcranial Doppler as well as the radio isotopic studies.